The Massachusetts Department of Public Health and the state are really prescribing exactly how that will be, and I believe that they will be telegraphing that to us, as the next few weeks go on. But generally speaking, we'll be moving on to folks with, at least now, we're immunizing folks who are healthcare workers, first responders, people in congregate settings like nursing homes who are at very high risk for COVID. And then we'll move on to folks who are at home, maybe older, a little bit higher risk for COVID disease, or folks who have comorbid conditions, which put them a little bit higher risk. And both the state and their PCPs will likely be reaching out to them.
The vaccine is actually very safe. There is a lot of misconception about the vaccine, that it was rushed through and so forth, but it absolutely was not. The Pfizer vaccine had over 43,000 people who were given the vaccine. The Moderna vaccine was about 33,000, but it was tested just like every other vaccine would be tested.
So we've taken a virus that can cause really horrible disease, and it will turn it at most into the common cold, and most likely you won't get it.
So after the second dose of the vaccine, after about 1 week, the Pfizer vaccine is about 95% at preventing symptomatic COVID disease. The Moderna vaccine was measured at 2 weeks after the second dose of the vaccine. It was 94.1%, so it's an extremely effective vaccine.
In terms of their side effects, most people will likely experience similar side effects that they got with the flu shot. With the first shot, typically it's just a sore arm where you get the injection, and that lasts maybe 24 hours or 36 hours. Some folks will experience maybe a low-grade temp, feeling a little punky, what we call myalgias or arthralgias or joint or muscle aches. Those things last about 24 hours and are generally very mild.
There are multiple ways that you can do that. The first way is to go through whoever the vaccine provider is that gave you the vaccine. So here at CCHC, you would be going directly to occupational health. But still, the CDC offers its own avenue for you to be able to do this through a system that they call their vSafe system. So if you were to search on the internet for CDC and vSafe, and that's V-SAFE, you would see their vSafe system. You can register there, and then you can go directly to the CDC with any of the adverse effects that you may be getting with the vaccine.
I guess I'd be lying if we're all feeling a little tired and a little stressed by what's gone on in the world the last 10 or 12 months. But I'm also feeling really quite optimistic. I think that as we roll out this vaccine, I think that we're going to start to see some serious improvements in both the prevention of serious disease and prevention of transmission. And we're all going to be able to get back to our lives again and doing the work that we really need to do.
We're about to hit another surge, and we're cautiously optimistic that this hopefully will be the last one. So, when we're talking about getting through the next 6 weeks or so, we are fully prepared to be able to do this. We have the supplies we need, we have the staff we need, we have the expertise that we need, we have the medications we need. We just have to make it through the next 6 weeks or so. And slowly but surely, the vaccine is going to help us develop herd immunity. So is there a light at the end of the tunnel? Yes, there is absolutely a light at the end of the tunnel. I feel quite good about it.